Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brummel.
Good afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Brummel. We have our new friend, executive producer of AM Tampa Bay, Aaron Jacobson, with us. And we as well have our TV and radio senior fellow, Jeff Wagstaff, in the, what do you want to call that, control center?
Yeah, kind of like a NASA control here in the big chair.
And across from me, we have world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for being here, sir.
Hello.
Traditional spine surgery used large incisions coupled with fusions, screws, plates, cages, and rods. That was typical in open procedures. Fusions usually didn't work out and were only compounded by the problem, and there's even a higher risk of failure, according to studies that show about an 80 to 90% failure rate when there are multiple fusions and when hardware is involved. Yet, unfortunately, today, many patients are still being told by other facilities that fusions are necessary for their surgeries. In addition to the risky invasive surgery being performed, those patients are subject to general anesthesia along with those side effects. Being totally knocked out means a patient can't observe or interact with the surgeon during surgery. And when the patient awakes, they can only hope that the invasive surgery they underwent was successful. Also, they are up against lengthy months of recovery and the toll that it takes on their lives. In addition, most of these hopeful patients are once again reliant upon heavy medications as they and their doctors truly await the outcome. These problems are almost non-existent with the Bonati spine procedures, the patented Bonati spine procedures, and they're highly successful. And the patients are consciously sedated. So that means they remain awake, aware, and alert, and they're able to constantly be interactive with the surgeon. And because of that, they're able to have some input and control over the outcome. They know immediately that the Bonati spine procedures are successful, and they're able to quickly get back to their active and normal lifestyles. And so effective are the Bonati spine procedures that many centers attempt to imitate, but they cannot successfully duplicate. Many of you may have recently noticed that other facilities claim to offer their own versions of that quote-unquote minimally invasive laser spine surgery, but they're kind of going back to old methods like using screws and plates and rods. I don't see how that's truly minimally invasive by today's standards. So a lot of these distraught patients that have undergone failed back surgery elsewhere, they arrive at our exclusive Bonati Spine Institute, and they're pleading for relief after multiple attempts, and failed attempts at that, at trying to receive remedies to their pain elsewhere. Well, once they come to us and they receive the patented Bonati spine procedures, they report an immediate 98% success rate when they leave here. So they're able to come in with problems and walk on out. So that's why we proudly say Bonati succeeds where others have failed.
Kimberly, I can't think of many doctors or medical procedures today that have a 98% success rate.
I know.
I mean, that's pretty strong.
That's pretty strong anywhere, let alone the medical field.
And the thing that's so amazing is we talk to so many patients week after week who've been helped by Dr. Bonati, and although the procedure relieves the issues that are causing them pain, the thing that's so amazing is that, like you were saying, with traditional invasive back surgery, it can take weeks, many times months to recover. Most of the patients that we talk, matter of fact, all of the patients that we talk to walk out of the Bonati Spine Institute the day of their surgery and return to a normal active life within a couple of days and very little, if any, pain medication.
I know.
And 98%, that's incredible. I mean, that's almost a guarantee. You really can't, you don't see those numbers anywhere else. So that's truly remarkable.
The statistics speak for themselves. So we'll get more into that with the patient that we're going to be talking to very soon. But later in this episode, we're going to have Jared Heyman. He's the founder and product visionary of something called CrowdMed. So this is where they try to harness wisdom of crowds to help solve the world's most difficult medical cases quickly and accurately. So I can't wait to speak to that guest. But up first... in our
You threw me on that one today. Up first.
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
On the phone, we have Jesus Castillo, and he's on the line speaking to us. Are you from Grand Rapids, Michigan? Do I have that correct?
Yes, I am.
Well, thank you for being here. We know that you're a patient of the Bonati Spine Institute, but why don't you kind of tell us your story? What symptoms did you have? How long did you suffer in pain? Let people know what your pain was. What were you feeling, and how did it limit you? And then how did you end up at the Bonati Spine Institute?
Well, I guess, first of all, mine didn't come on suddenly. Mine came on gradually.
Okay.
It started first with some pain on my side, almost like if my ribs were out of place. And previously to that, I I visit quite a bit a chiropractor, and I had gone in a few times previously because I felt like these ribs were out of place, and surely he'd look at it and feel it and say, hey, yeah, it seems like they're out of place, so he would adjust and the pain would go away. But then it started happening more and more and more repeatedly. And I would deal with it for a few weeks until he saw it, or it would just go away eventually. But then I'd say about 4 years ago, the pain kind of set in, and it wouldn't go away, and it would last then months. And then they'd go away for a little bit. I'd take maybe some over-the-counter pain medications, and that would ease it too for a little bit. And it would come and go. And then I remember one summer we were working out at the YMCA. My wife got me to go, and I was doing some exercise on the floor, and all of a sudden it was major pain, and then I couldn't even get up out of the floor. My wife and several people had to get me up off of the floor, and from that point on, it was consistent. And the pain was getting worse and worse. So I, of course, went to my chiropractor and told him about it. They tried everything possible, to the point when he finally said, I think you need to go and see some specialist, because I've done everything that I know to do, and nothing seems to work.
Jesus, when you...
So then from that point on, I talked to my primary doctor. He referred me to a specialist. They did the whole thing with the cortisone shots. Well, he tried to do a cortisone shot. I told him no, because I've never had a lot of success with cortisone shots. I've had operations on my shoulders, and every time I would get them, if at all, maybe a day or two, the pain would subside a little bit, but the pain would come back. And in the last attempt that they did, I had a double shoulder operation. I ended up with some side effects. I couldn't even taste food for a month, and it was horrible experience. So when I went to the specialist for that major pain that I was going through, I told them, no, I'm not doing the cortisone shots, because I had bad experience with that, and it never ever really worked. So of course then they did the MRI thing, and then later on they did the physical therapy as well, and
Jesus,
the therapy would help a little bit.
Jesus,
let us jump in for a second.
Yeah.
Sounds like they put you through the ringer. What led you to the Bonati Institute?
Well, actually, I want to, before you jump ahead, I had a quick question, though. These doctors that you saw, they wanted to do what? Something more invasive?
Well, actually, they didn't even want to do that, because after looking at the initial imagery, that they've taken, X-rays and whatever, and they said that my situation was pretty extensive, and that really the areas that were affected, like, for instance, the lower part of my neck, middle back, and lower back, they said it was so extensive that they wouldn't even recommend surgery because it would involve breaking ribs from the side, going into the side, moving organs around, and getting to it. They said, hey, this operation, just the recovery alone would be more painful than the actual pain that I was feeling then, and the recovery time would probably be so extensive, and they weren't guaranteeing that I'd end up getting well ever again. So they said the only thing that they can do, if anything, would be work on my neck, and only if I could not swallow any longer, then they would operate that. But that's all they would do. That they would prefer me just going to a pain clinic and dealing with the pain.
Wow, that's no way to live. Jesus, can we ask you to hold on for just a minute? We're up against a break, and Kimberly's going to tell folks who are listening if they're experiencing neck pain, back pain, headaches, issues with sciatica, how to get a hold of the Bonati Spine Institute.
Well, they can give us a call at 855-267-0482 or visit the website at Bonati.com. After the break, we're going to hear more from Jesus Castillo, and he will tell us more on what he went through during surgery and kind of what that Bonati experience was like. You're listening to American Medicine Today on News Radio 970 WFLA. We'll hear more on the flip side of the break. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at Bonati.com.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.